became an overdose prevention coordinator at the University of Missouri, St. Louis. Tell us about that shift and what you did there.
Yes, another pivot. Look at me, the queen of pivots. I pivoted again and I knew I wanted to go into an academic space because I knew I needed healthcare. So I was like, I need insurance. I need to pivot. So I pivoted into harm reduction, which I was not familiar with before I became an overdose prevention coordinator. But once I got there, I loved it. So harm reduction, for those who don't know, is about reducing harm. Specifically, historically it comes from drug use. So reducing harm when it comes to using drugs. So giving out needles, giving out Narcan, um, and things like that. And as I was in this role and I learned more about harm reduction, I was like, wait, I've been doing harm reduction my whole life. Everything is harm reduction around me. Wearing a seatbelt, taking birth control, um, wearing a mask. Hello, guys. Is harm reduction. And I fell in love with looking at public health from a harm reductionist lens. And I kind of call myself a harm reductionist now, now that I even like left that role. Um, so yes, I love harm reduction. I love working at UMSL. Such a great informative experience for me as a public health professional.
And I want to talk more about that pivot for a second, because you're saying, okay, you're in this maternal health space, you build the skill sets, and then you're like, okay, I love this work that I'm doing. I also need to get like health insurance and like get the things that grown adults typically would like to have like a I don't know, a solid base and foundation to live a healthy life, which I think is very important and probably we don't talk about enough in public health cases. But I'm not going to go there. They shift this more. Okay, so you're shifting into overdose prevention. How did you maybe like rationalize that in your head as your next step, or how did you like think about, okay, yes, this is something that I want to do, and then in doing that you were able to like build this more bigger appreciation for harm reduction, and kind of looking back on your life and seeing that this is something that you've already been kind of implementing and already kind of been doing, but now you're getting like maybe like a broader perspective on that.
Yeah. So my pivot into harm reduction, I knew I wanted to do something with grants. So my position was grant funded. I knew I wanted to write grants, and I wanted to learn more about the grant making process. Um, and so working at the university, we were actually an intermediary. So we got funds from the Department of Mental Health. It got funneled through us, and we funneled it out to community, um, which I don't think a lot of people work within that space and would necessarily call that public health. I feel like a lot of my positions so far have not been the typical public health career. And as an overdose prevention coordinator, I remember in my interview, I was talking about being a pharmacy technician, and I told them, I was like, yeah, I lie. I lie, and I do whatever I need to do to make sure community is good. And that was one of the things that they were like, we need you here. That's a harm reductionist. And I didn't even view myself as a harm reductionist. I was just like, I just love community. And if someone can't afford something, we're going to figure out how they can afford it. Um, and so it was more not just the overdose prevention stuff, because I was like, it's important. St. Louis has a high rate of overdoses, Missouri, the state, too. But I was more thinking about that grant piece. How do people get funding? What do grants look like? And how can I write grants for my community? So that was kind of my thought process behind that.
Yeah, I love that, and I'm glad that you're able to share that, because that's maybe a perspective that someone might need to hear. Because I think maybe too often we get stuck in a bubble of what we're doing, but not realizing that the skill set and the knowledge that we have can be applied in many different ways, as well as there's so much that we can continue to learn. To your point, like you wanted to do grant writing and really understand how that plays into the role, and the world of public health, which I think is awesome, and kudos for you for being able to do that pivot and successfully do that work.
Yes, 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 yes. Thank you.
And you were or are, I can't remember, you're a board member at Living in Victory Sober Living. How do you come across that? What was the impact and importance, and what did you learn from being a board member?
Yes, I still am a board member. I'm actually the marketing and outreach chair. Just got that role. But I got introduced to Living in Victory through my work as an overdose prevention coordinator. So I was working on two grants while I was there. One, the state opioid response grant, and the other center, which was about centering Black men who use drugs. We started that grant after a mass casualty um, that happened in St. Louis, a mass casual overdose that happened. And we realized, like, hey, no one is supporting our black brothers, so we need to make a grant to do that. And that was a grant that used a community advisory board of people with lived experience, which was super cool. That was something I had never done before. Um, and through that, I met the CEO of Living in Victory, and she was looking for board members. And she came to me and asked me, and I was just like, cool, yeah, I'll do it. I'm so down to be a partner in crime. And um, through that, I have met so many other people with lived experience, and met so many people through recovery and who are currently using and need harm reduction. Um, and it through that, it made me want to start hosting healing spaces. So with two of my coworkers from UMSL, we decided to create healing spaces and healing circles for Black men and women affected by substance use. So we host them once a month. We always have food and harm reduction supplies, and the conversation never centers around their drug use. It is always about community and it's about personal growth. Um, so our first one we ever did was about self care and what does that look like, and how do you forgive yourself for any transgressions you've done or anything you feel like you need to forgive yourself for, and loving on yourself. And it's been an amazing experience, I will say. Just listening to people's stories and them saying, like, no one ever just sits and listens to us. And it's like, I'm so glad I can be the person to sit there and have you, like, be like a pseudo therapist for you, in a sense of just like sitting here and having a meal with you and treating you like a human being. So that, I don't even remember the question anymore, but um, I think that just speaks to like my love for community and just going back to, like, even though I wasn't doing maternal health work, um, still thinking about community outside of that. So yeah, it's really a special experience. Everyone should do something with people with lived experience of any sort.
Yeah, and I appreciate the fact that you're also doing this work and just being someone that sees the value in someone being a person and a human. And I think too often we other people and we create these narratives in our head, but we just don't see people for like who they are, what they are, who they want to be. And I think that that is so important, especially in this work, to be seen. And I think that that's one of the first steps in like just being comfortable in a space. So shout out to you, and thank you for doing that work. And want to ask one other question here. So you said that you started off as a board member because you were part of this community advisory group that did grant making, was introduced to the executive director who asked you to become the board member and become a board member, and you shared that you are now a board member that's overseeing the marketing of the week. So like how did that progression happen for you?
It happened very quickly. uh, I became a board member in August of 23, and I've helped to get the board off the ground. We're still figuring things out as we go. Um, and they needed a marketing and outreach chair, and stepped up and said, I'll be it. I love talking to people. I can definitely market whatever you need me to market. We have not started yet on our new marketing campaign for 2025. Um, but I feel like a lot of the things I do are based off what people ask me to do. Like I said before, I'm very busy. I'm a busybody. Don't be like me, unless you want to be like me. Um, and I kind of just like said yes. I know people are in the season of saying no, but sometimes when people need it, I just say yeah, and you just get the work done because you know it needs to be done. So yeah,
Yeah, and I appreciate you sharing that. I feel like there's so many ways for us to make impact outside of like maybe our traditional 9 to 5 job, and really finding those spaces where we can use our skill sets to help move forward work that's important to us. I think is really really a good thing to do. So once again, kudos for you, and I hope that you all are able to, I guess, hit all your goals, get to the achievements that you'll hope for 2025.
yes, yes.